Hi, I'm Ariana. I'll be your student nurse for today. Can I ask you your name and date of birth?
Carlesi Calcano, 0205-2000.
Okay, I'm gonna close the curtain. Okay. Today I'm gonna be doing a head to toe assessment on you. I'm gonna be taking your vital signs, okay?
Okay.
Okay, so I'm gonna start with your heart rate. So if I could see your wrist, just put it flat on the bed. Okay, your heart rate was about 72 beats per minute, and then your respirations were about 18, so all within normal range. I'm gonna go ahead and take your blood pressure now.
Okay.
Okay, I'm gonna roll your sleeve up a bit. Okay, I stopped feeling it around 130, so I'm gonna pump up to 160 and take a listen. Your blood pressure is about 120/68, so that's normal. Next, I would take your temperature, whether it was orally, axillary. Do you have any pain today?
No.
Okay. I would then visually assess you. So assess your overall general appearance, looks fine, you're appropriately dressed, you're well groomed, everything looks to be normal. I would then do my neurological assessment. So your eyes blink equally. No, there's no drooping of the eyelid, no drooping of the mouth, and your speech is not slurred. So it's good. I would assess your orientation then by asking you the date.
September 26th.
The time, the relative time.
8:15.
Yep. Do you know where you are?
Oh, I'm in the hospital.
Do you remember what I said my name was?
Yes. Ariana.
Okay, good. Next, I would have you grasp my fingers. Good. So out of 1 of 4, your strength would be a 4, and you squeeze equally with both hands, so that's good. I would then do a lower extremity strength test. So I'm gonna press the palms of my hands against the soles of your feet. I'm gonna ask you to push against the force. Just push against. And I'm gonna put my hands on the top of your feet and ask you to push against them. Okay, it's good. I would then ask you if you could touch your finger to your nose for me. Okay, you can stop. And then raise and lower your left leg. Okay, next I'm gonna assess your sensations. So I'm gonna now I need to grab something, but I'm gonna touch you with either something soft or something sharp, and I'm gonna ask you where you feel it and whether it's soft or sharp. Okay, can you grab me that? Okay, so close your eyes for me. And where did you feel it, and was it soft or sharp?
It was around here, and it was sharp.
Okay. And where did you feel that? What was it? What did it feel like?
Soft.
Okay, good. Okay. After I do that, I would listen to your heart. So I'm gonna listen to your heart for 1 full minute. Your apical heart rate was about 72, so normal, and it matches your radial. I'm now going to assess your pulses, so may I take off one of your socks?
Yes.
Okay, first I'm going to find your dorsalis pedis pulse. Okay. And I'm going to find your posterior tibialis pulse. Okay, good. I would then assess for lower leg edema. So you don't appear to have any edema. I'm gonna put your sock back on. Okay. Next, I would visually assess your, I'm gonna ask you first. Do you get chest pain?
No.
Do you feel faint when you stand or walk?
No.
Do you get chest palpitations?
No.
Okay. Next, I would visually assess you. Again, you're pink in color. Your color is normal in your face and your body. You don't appear to have any difficulty breathing, and you don't have noisy respirations without the use of my stethoscope. So next I would take a listen to your lung sound, so if you could sit up for me and dangle off the bed. I'm gonna ask you to take a couple deep breaths in for me. Take a deep breath. Another one. Another one. Another one. And one more. Okay. Your lungs sound good, no rhonchi, no wheezes, or anything like that. I'll help you lay back down. Okay. Then I would ask you some questions. I would ask you, do you ever get shortness of breath?
No.
Do you ever get shortness of breath walking, climbing the stairs, or washing yourself?
No.
Do you have a cough?
No.
And do you have any respiratory history of asthma, coronary obstructive pulmonary disease, or smoking?
No.
Okay. Next is the GI assessment, or your gastrointestinal assessment. So I'd ask you, when was your last bowel movement?
This afternoon.
Okay. Any problems having bowel movements, like constipation or diarrhea?
No.
Okay. And are you passing flatulence?
Yes.
Okay. Then I would look, listen, and feel. So looking at your stomach, it doesn't look distended or anything like that. So then I would take a listen to all four quadrants. Can I lift your shirt up a little bit? Can I pull your pants down just a little bit? Okay. Your bowel sounds sound normal, no hypo or hyperactive bowel sounds. I would then feel your stomach. So is it okay if I feel your stomach? Do you feel any pain or discomfort?
No.
Okay, and your stomach is soft, not firm, so that's normal. Next, if you were in a gown, I would conduct a skin assessment. So I'd look for any bruises, cuts, wounds, red areas, skin breakdown, and then I would document my findings.